I would like to welcome everyone today to this public meeting, which, as you can see, is titled Unite Educators and Health Workers, Oppose the Ending of COVID Protection Measures, Lives Before Profit. This meeting has been co-sponsored by the Committee for Public Education and the Health Workers Rank and File Committee here in Australia. My name is Patrick O'Connor. I'm a public school teacher. I'm a member of the Committee for Public Education and also of the Socialist Equality Party, and I'll be chairing the meeting this afternoon. To explain the format of our meeting, after I make some brief introductory remarks, we are going to hear from four speakers, Julia Thomas, Katy Kinner from the United States, Craig Wallace, and Sue Phillips. I'll introduce each of those more fully in turn. After the four contributions, we're going to open up the meeting, and we do encourage your questions and comments. If you have questions in the course of the reports, those can be typed up in the chat box and submitted during those contributions. Or if you prefer, you can wait till the discussion period and we can unmute you and you can speak to the meeting. We do very much encourage, as I said, your participation. We're keen to learn of people's different experiences with the pandemic, including the situation in your workplace, the situation confronting the immune-compromised and vulnerable layers of the population, as well as the related political issues that flow out of this disaster. After that discussion period, I'm going to make some brief announcements and then we'll conclude the meeting, likely somewhere between 5 and 5:30 this evening. I would like to first place this important discussion that we've convened today in the context of the ongoing catastrophe that is the COVID-19 pandemic. Total global deaths are officially recorded at 6.6 million. This is undoubtedly a significant underestimate, with a real toll, in fact, substantially higher. Even just taking the official figures, however, that includes 1.9 million dead in Europe, 1.6 million people dead in North America, 1.5 million in Asia, and 1.3 million in South America. This, as I said, is an ongoing crisis. We've seen in the last few days in China, a country of 1.6 billion people, there are now indications that its zero COVID policy, which has proved very successful in repeatedly eliminating the virus from that country, is now under extreme pressure. There is a surge of infections in Guangzhou, and multinational corporations, including Apple, have issued various threats that further lockdowns may see a withdrawal in their investments in that country. Last Friday, the National Health Commission in China issued 20 measures, which significantly curtailed aspects of their zero COVID policy. That include a reduction in mass testing protocols, restrictions on the ability of localities to issue lockdowns, shortening of quarantine times for close contacts of people infected with COVID-19. Now, if that zero COVID policy ends in China, we will see a further very rapid escalation of mass death in that country. Of course, internationally, alongside the fatalities, there is mass incapacitation, with the complex long-term health implications of long COVID remaining a largely unknown question. In the United States alone, according to a recent Brookings Institution analysis, at any given time, there are now an average of 1.1 million people out of work due to their debilitating long COVID symptoms. Now, this ongoing catastrophe is not a natural disaster, not purely a natural disaster. It is rather, and centrally, a politically engineered social crime. The pandemic could have been prevented, but to the extent that public health measures have cut across the profit interests of big business, they've been met with hostility and derision. The former British Prime Minister Boris Johnson, in a sense, spoke for the entire ruling elite when he infamously said, "No more effing lockdowns, let the bodies pile high by the thousands." Now, it's very significant that here in Australia, the large majority of COVID casualties have come under the federal Labor government of Anthony Albanese. In relation to the political issues that involves, the Socialist Equality Party has recorded a video, a 9-minute long video, which we plan on circulating on social media and through other forums to outline the significance of the developing pandemic in Australia this year. So I'd suggest that we watch that video before we continue with the meeting.
The COVID-19 pandemic is not over. Worldwide, it has caused more than 20 million deaths, and the death toll continues to rise. hundreds of millions of people have been infected, as virtually every country's government has embraced the murderous let-it-rip policies. According to official figures in Australia, there have been almost 10.5 million cases detected and nearly 16,000 deaths. In November, studies revealed that 2/3 of the population have been infected. This includes nearly 70% of all children. For those aged 1 to 4, all of whom are unvaccinated, 79% had indications of infection. Compare today's figures to 1 year ago. On November 30th, 2021, there had been just 27,904 cases in the entire country and 2,000 deaths. This means infections have increased nearly 400-fold. The speed of the spread is staggering. Australia has reached and even exceeded infection levels per capita of other countries in just 10 months. Every day, the pandemic is downplayed or mentioned in the past tense. There is an attempt to condition the population into thinking there is no danger. This is a lie. Omicron was never a milder variant.
We were actually working in COVID during lockdown, and I was really scared working on a COVID ward.
The Premier said that we were coping in the midst of the COVID pandemic last year. He lied.
He's definitely just let it rip, and it's more for economic benefit rather than what's happening in the hospitals. Because during the Omicron wave, we were still smashed as well.
Yeah.
But they were saying they didn't want to go back to lockdowns again.
COVID cannot be lived with. It is killing people and causing thousands more to suffer from long COVID. New variants of the virus are sparking new waves, an entirely predictable and preventable situation. Leading health experts warned what the ending of all restrictions would mean.
What's happening now is absolutely unprecedented. And when you look at the known risks in terms of death, acute disease, and longer-term disease, and the unknown longer-term risks of an illness that replicates in pretty much all of the body tissues, if you keep grounding yourself in that reality, you just have to pinch yourself because you go, well, what's happening is crazy. So we are now infecting ourselves and, more critically, our children repeatedly with this virus that is rapidly mutating and changing its form with no firm knowledge of the long-term consequences, which we can't have because we haven't had it for the long term.
For raising these warnings, health experts like Dr. Berger have been censured. The question must be asked, who is responsible for the disaster now unfolding? The entire parliamentary establishment is responsible, including Scott Morrison's coalition government. However, the essential role has been played by the trade unions and Labor Party. They have worked hand in glove to remove all restrictions and let the virus rip. Since coming to power, the federal Labor government of Anthony Albanese did what Scott Morrison could not. In less than 6 months, Albanese has removed every basic safety measure. Here is a timeline of events. In June, mask mandates were removed for airport terminals. The Victorian Labor government removed 3-dose vaccine mandates in education, food distribution and processing. On July 8th, Labor Health Minister Mark Butler said Australia had moved beyond coordinated public health measures, saying, quote, "The message is, take responsibility, make your own choice," end quote. On August 31st, after Australia's deadliest month of the pandemic, the anti-constitutional National Cabinet met and reduced mandatory isolation from 7 to 5 days and removed mask requirements on domestic flights. Albanese ended pandemic leave payments on September 30th. He also ended free rapid antigen tests for pensioners and welfare recipients. In September, the National Cabinet ended daily reporting of COVID statistics and removed mask requirements on international flights. In October, Labor then scrapped all COVID-positive isolation requirements. In turn, New South Wales and Victoria dropped the requirement to report positive rats. This is a declaration of war against public health, workers, people with a disability, and the immunocompromised. While declaring it is down to individual responsibility, the Labor government has willfully withheld accurate and truthful information. One could easily describe the situation as madness. In fact, this is how Albanese himself described such a scenario in Parliament before becoming Prime Minister.
I'll tell you what madness is. Madness is saying, let this disease rip. Let people die. Let whole economies be shut down. Let's stop us being able to return to our way of life. That is what is madness.
The homicidal reopening policies are driven by the demands of big business, of which the Labor Party is the closest ally. In their eyes, the economy must be reopened and the population must forget the virus exists so profits can flow. The deaths of tens of thousands and the disabling of thousands more must not get in the way of filling the coffers of the rich. Operating as industrial policemen, the unions have spearheaded the reopening by suppressing workers' opposition. In both New South Wales and Victoria, the teacher unions played the key role in forcing educators back into unsafe classrooms. This had nothing to do with concern for children's education or mental health, but was to ensure parents could be driven back to virus-ridden workplaces and factories. The health unions did the same. In December 2021, they worked out a protocol to force COVID-infected health workers back to work, setting a precedent for all other industries. In August, prior to the decision of the National Cabinet, Health Services Union National President Gerard Hayes demanded the scrapping of mandatory isolation. Not a single union across any workplace or industry has organised resistance to the reopening drive. All have enforced the return to work and now peddle the lie that the pandemic is over. But workers are willing to fight. Across the country, health workers, educators, rail, logistics, industrial and other workers have launched or voted overwhelmingly in favour for strike action against their intolerable conditions. They join their working class brothers and sisters internationally who are in a common struggle not only against the bosses, but capitalism and its representatives. This includes the social democratic parties, the various Labor parties, and the unions themselves. For educators and health workers to take a step forward in protecting themselves, their families, the population from infection and death, they must break with these organisations.
Over the last 2 years with COVID, we just dealt with it, right? So we toughed it out. But it's been 2 years, and I think we've been through enough that I think it's about time we speak up.
We did our absolute best. We want better ratios to help patients and to help fellow nursing staff.
Workers must take control of the response to the pandemic out of the hands of the pro-business governments and unions and into their own. New organs of struggle must be built in every school, hospital and community. These independent committees of rank-and-file workers must meet to democratically discuss and formulate their own demands. The mantra that everything must be sacrificed for the wealth of a few must be replaced with the demand, lives before profits.
An important video which we encourage everyone here to assist in circulating this on social media when we release it. I would like to, just before I introduce our first speaker, make just a couple of final additional points. As the video emphasised, the let it rip approach on COVID is a class issue, and it now goes hand in hand with the wider corporate offensive against wages and conditions. Now, the Albanese government will recall, prior to taking office, based its election campaign around promises of a better future, fairer future, and so on. Since then, however, what we've seen is the implementation of austerity spending cuts, rhetoric around sacrifices, and so on, in order to deliver the budget back into surplus on behalf of big business. The last budget was itself based on forecasts of declining real wages for workers for at least the next 2 years. Now, state Labor governments are likewise proceeding with this anti-worker agenda. Just to take one example, one could list many, but in Western Australia recently, the Labor government of Mark McGowan is attempting to oppose a substantial real wage cut on nurses. Again, only shortly after being hailed as heroes and all the rest of it, we see the real agenda emerge. The Nurses Union in Western Australia recently agreed to a 3% annual wage deal. That is a real wage cut in conditions where official inflation is nearly 8%. However, that deal was met with a wave of hostility from nurses. Senior officials were booed in meetings. There was outrage on social media. In the face of that response, one official appeared to backtrack and suggest that the deal could be voted down. And then what happened was that the state government of Mark McGowan took the Nurses Union to the Industrial Relations Court and imposed a gag order on all union officials, preventing them from commenting on the deal before it's actually put to the vote. In other words, that is a pretty extraordinary attack on the basic democratic right of free speech. We've also seen this week the threatened lockout of nearly 600 tugboat drivers by the transnational giant Svitzer. This would have marked the first national lockout since the provocative 2011 grounding of the entire Qantas fleet. In the Svitzer issue, the company is demanding that its workforce accept a nominal wage rise of just 1.5%. On Friday, just a couple of days ago, the Fair Work Commission seized on the Svitzer lockout in order to strip workers of their right to strike, ordering a 6-month suspension across the board on all industrial action. Now, this has been falsely hailed as a victory by the unions. In reality, it sets a dangerous precedent for attacks on other sections of the working class. As was outlined by Max Boddy in that video, there is enormous opposition to what's unfolding, but it does need to be organised. Rank and file committees must be built in every workplace, unified both nationally and internationally through the International Workers Alliance of Rank and File Committees. Our speakers today will detail the impact of the COVID-19 pandemic and also elaborate on this perspective underlying our Rank and File Committee's fight for a zero COVID policy. I'm very pleased to be able to introduce our first speaker, that is Julia Thomas. She is a leading member of the Health Workers Rank and File Committee. She is also a member of the Socialist Equality Party and a regular writer for the World Socialist website. So welcome, Julia.
Thanks, Patrick, and greetings to all who have joined our meeting today. The Health Workers Rank and File Committee, in collaboration with the Committee for Public Education, have launched this campaign for united action against the dismantling of COVID-19 public health measures by federal and state governments. The initiative for this meeting importantly arose out of a discussion at one of our rank and file meetings and is an indication of the striving for united action by workers and the importance of these committees in advancing their fight. On October 13th, we published a joint statement with the CFPE on the World Socialist website, calling on all workers to oppose the Albanese Labor government's lifting of COVID isolation requirements and paid pandemic leave, which came into effect on October 14. We called for workers to establish rank and file committees to develop this fight, independent of the corrupt trade unions, which have spearheaded the government's let it rip policies and are actively blocking a unified struggle by workers for decent pay and safe working conditions. The ending of COVID isolation and the abolition of most pandemic leave payments for infected workers is a declaration of war against public health and working people. This marked the final stage in a protracted onslaught on any coordinated public health response to the pandemic in this country. These decisions are being made without any democratic support and behind the backs of the population by the National Cabinet. This extra-constitutional body, which operates in secrecy and by decree, is dominated by Labor. As a result, COVID-19 cases are once again on the rise across Australia, driven by highly contagious and immune-evasive Omicron, XBB and BQ1 subvariants as part of a global upsurge of the virus, with the spread of numerous new subvariants being described as a variant soup amidst already waning levels of vaccine immunity. Over the past week, more than 79,000 new infections were recorded across the country, 31% higher than the previous week. The sharpest rise was in Queensland, where infections soared 73%, and in New South Wales and Victoria, cases have doubled within a fortnight. The dismantling of testing, with reporting of positive rapid antigen tests no longer mandatory, means that the true number of cases is far higher. And the death toll is also rising, with over 15,900 recorded COVID-19 deaths in Australia. Across the country, over 2,100 people are now hospitalised and 64 are in intensive care. Health workers are on the front line of the pandemic and confront a health system at breaking point. By every metric, the healthcare system is in its greatest crisis of the past 80 years. There are not enough nurses to meet demand, nor hospital beds for patients. Multiple states have seen record high ambulance ramping outside emergency departments. Although these conditions existed and were worsening prior to the pandemic, the emergence and unmitigated spread of COVID has greatly exacerbated this crisis. Governments, with the assistance of the trade unions, have now created the conditions for new and even deadlier surges of the virus that threaten to overwhelm hospitals entirely. Health workers, their families and patients' lives are being constantly put at risk. From the outset of the pandemic, many health workers were denied adequate PPE, including N95 masks. Over the past few months, health workers have reported to our committee and sent us notices of the removal of N95 mandates, including in aged care and in hospital ICUs. These are now belatedly being brought back in some healthcare settings as infections soar. Principled health professionals, scientists and workers have spoken out against capitalist governments' policies and about their conditions. Many of them have spoken with the World Socialist website through our global workers' inquest into the pandemic. Those who speak out are increasingly coming under attack and face censorship. In July, our committee, along with the SEP, the Socialist Equality Party, launched a campaign in defence of Dr. David Berger, who was threatened with deregistration by the Australian Health Practitioners Regulation Agency, or AHPRA, because he opposed the government's let it rip policies, called out COVID misinformation, demanded a scientific approach to the virus, above all its elimination, and did this publicly on his Twitter profile. The Health Workers RFC and the CFPE passed resolutions in defence of Dr. Berger and gathered statements of support from workers, students and health professionals, which were published on the World Socialist website. Late last month, Facebook placed restrictions on the account of Craig Wallace, who we're very pleased to have speaking today, after he shared a Jon Snow Project video titled "Which Halloween Mask is Best?", which explained the necessity of using appropriate respirators to protect against COVID. A Sydney health worker and member of our committee shared Wallace's interview with the World Socialist website in several Facebook groups. In one group, her post was flagged and her account was subsequently restricted. A key role of rank and file committees is to mobilise workers to defend those who come under attack for exposing the truth. Albanese's government is embarking on an austerity agenda with $2.4 billion in cuts to public health spending in the recent federal budget. Within days of the federal election in May, before it was even clear whether Labor had formed a majority, Treasurer Jim Chalmers said, "Sacrifices are necessary if we are to make progress." In line with this, the government has opposed any across-the-board pay increases, and to the extent that pitiful wage rises are granted, they must be tied to greater productivity, that is, to cuts to conditions and intensified exploitation. The working class does not accept this policy. A fierce opposition has erupted among workers all over the globe who face the same assault on their wages and conditions, with strikes, mass protests and demonstrations. Health workers and educators have been at the forefront of many of these struggles, standing up in defence of their patients, students and society at large. In Australia, strike activity has reached its highest level since June 2004. In the year ending June 2022, industrial disputes resulted in the loss of more than 230,000 working days, more than the combined total from January 2018 to June 2021. Workers are beginning to recognise that if they are to take forward their fight, it must be independent of the unions. In August at Lifehouse, a cancer treatment centre in Sydney, nurses penned an open letter to the New South Wales Nurses Union demanding that the union endorse a no vote on a regressive enterprise agreement. Nurses condemned the union for, quote, effectively ceding the narrative to management by presenting the agreement without a no campaign. Our rank and file committee supported the nurses campaign as an important first step, which shows the way forward for other health workers. Members of our committee and the Socialist Equality Party campaigned for a no vote, speaking to Lifehouse workers as well as those at other hospitals. Nurses decisively voted down the agreement on September 12th. The next step, we emphasised, is for nurses to break from the union bureaucracy and form independent rank and file committees to develop demands based on what they actually need and not what management says is affordable, and to link up with other health workers. New South Wales public sector nurses and midwives have gone on strike 4 times this year, after over a decade without statewide action. A 5th statewide strike has now been voted for and will be held on the 23rd of November, so this coming Wednesday. However, the nurses' struggle has been entirely diverted into an election campaign for the Labor Party, with the union supporting opposition leader Chris Minns' platform of pro-business health reforms ahead of the March 2023 election. This didn't include nurse-to-patient ratios or anything on pay. Nurses also face exactly the same conditions across other states, but the Nurses Union is blocking its membership from unified action. In WA, as Patrick went through, nurses similarly face a 3% pay increase against 7.3% inflation and no guaranteed minimum nurse-to-patient ratios. Last Tuesday, the ANF, the Nurses Federation, tried to force through a sellout agreement with the McGowan government, calling off a planned strike. Nurses responded furiously, with the ANF leaders booed at nurses' meetings and deluged with messages from nurses denouncing the betrayal. In response to the nurses' rebellion, the Labor government rushed to the State Industrial Relations Commission and obtained an order delaying the ballot and banning union employees from making public comments to push for a better agreement. The union has long been preparing this sellout. While nurses in the ANF are demanding a 10% pay increase and legislated nurse-to-patient ratios, ANF Chief Executive Mark Olsen said back in October, quote, I don't think any of our members expect the government to agree to a 10% wage increase, and that the demand was merely a measure of frustration and anger of nurses. His comments expressed the contempt of the entire union bureaucracy for its rank and file members. At a stop work meeting of New South Wales nurses in June, then General Secretary of the New South Wales NMA, Brett Holmes, opposed a motion for nurses to demand a 7% pay rise, declaring, quote, feel free to roll me, i.e. vote against him. I'm in a much better financial position at the end of my career than you are. To fight for their interests, workers must know who their friends and their enemies are. Your allies in these struggles are all workers in this country and throughout the world. But you can't fight with your hands tied behind your backs. Workers must be independent from the organisations that act as the policemen for governments and big business. Our rank and file committees are not new unions. They are democratic organisations controlled by workers themselves, capable of discussing and developing demands based on the needs of workers, not governments and corporations, and linking workers' action across the country and internationally. What is clear in the course of the last almost 3 years of the pandemic is that it cannot be fought on a national level. Pandemics know no borders, just as global warming and war doesn't. The experiences and struggles of Australian workers are an international one and must be linked with workers in New Zealand, throughout Asia and globally. In our statement, the Health Workers RFC and the CFPE propose the following demands as a starting point. And these include implementing the necessary public healthcare measures to combat COVID-19, including mask wearing, social distancing, ventilation, remote learning, as part of a broader program to eliminate the virus, massively expand spending on public health and education, and the privatisation of essential social services, an immediate across-the-board pay increase of more than 20% with automatic monthly cost of living adjustments, implement minimum nurse to patient ratios, maximum school class sizes of 18 to 20 students. Governments and the unions will say that these demands are unrealistic because there is no money. Meanwhile, corporate profits are at record levels and billions are allocated to the military and war. They also claim that there's no alternative but to live with the virus. But the scientific tools to eliminate transmission are well known and have repeatedly eliminated the virus in Australia, New Zealand, and China. These measures impinge on the demands of the financial elite for continuous production and profits. Therefore, the fight for safe, high-quality healthcare available to all requires a fight against the capitalist profit system and for socialism to bring healthcare under the democratic control of the working class based on social need, not private profit. And we urge you to join this fight for rank and file committees today. Thanks.
Thank you very much, Julie, for that. Our next speaker is joining us from the United States. We're very grateful to Katy Kinner to make herself available. Katy is a member of the Socialist Equality Party in the United States, our sister party of the SEP here in Australia. I know that there are many people, myself included, on this meeting who followed with great interest the development of the fight for rank and file committees in the United States. That includes amongst railroad workers and also car manufacturing workers. The latter, especially through the critical campaign that's been waged by Will Lehman for President of the United Auto Workers. Just for those not familiar with this campaign, the United Auto Workers, which is the key union, one of the largest and oldest unions in the United States, its entire leadership, virtually en masse, was prosecuted and jailed for accepting large bribes from the car company executives. As a result of those legal processes, the courts have ordered direct elections for union leadership positions, including for president. And this is the first time that direct elections have ever occurred. Taking advantage of this opportunity is Will Lehman, who's been nominated by the Socialist Equality Party and the International Workers Alliance of Rank and File Committees to wage a campaign for president. Will is a Mack Trucks worker in Pennsylvania, and he's campaigning to abolish the UAW bureaucracy and return power to the rank and file on the shop floor. Katy herself is a nurse. She's written for the World Socialist website on numerous occasions, primarily on struggles waged in the last period by American nurses. I believe she's logging in the evening in her time, and that she's also come off a nursing shift earlier today. So again, we're very grateful for your appearance, and warm welcome to Katy.
Thank you, Patrick. Good afternoon, everyone. Yep, it's about 8:30 on Saturday night here in California. I'm, as Patrick said, I'm a nurse in California. I specialize in oncology, which is the type of nursing, obviously, that sees patients who are often immunocompromised and thus extremely vulnerable to COVID and other viruses. I'm also a member of the Socialist Equality Party, and I want to thank everyone for allowing me to speak at this meeting and to speak about the conditions that healthcare workers and workers of all industries are facing in the US. When I read about what's going on with healthcare workers in Australia, and when I listen to the speaker before me, Julia, and her important report, I'm struck by the similarities that we face, which really underlines the international characteristics of our struggle. In the US, conditions in healthcare, like Australia, are horrendous. This can really be seen by taking a closer look at the conditions in the country's emergency departments, where many current issues like the spread of COVID, the spread of flu, the spread of RSV, as well as long-standing social issues like the lack of primary care, the poor management of chronic conditions among the poor and working class, closing hospitals and clinics, has led to an extreme overcrowding of the nation's emergency rooms, which again, as Julia also stressed, these are not new conditions, but just greatly exacerbated by the COVID-19 pandemic. At the same time, ICU beds are full, so patients who walk through the emergency room or are deteriorating on a less acute unit have nowhere to go, and they end up inevitably deteriorating with nurses struggling to take care of them with unsafe patient ratios. ER physicians and ER nurses in the US recently wrote a letter to President Biden. And in this letter, they paint a devastating picture of the ongoing crisis that's overtaking the emergency departments across the country. And they explain that healthcare workers are at a breaking point. The Biden administration has not responded to this letter. And I won't go through every single detail, but the doctors and nurses describe patients passing away in the waiting room, unnoticed for several hours, physicians seeing patients outside in their cars due to lack of room in the emergency room, children in respiratory distress waiting 10 to 20 hours to be admitted to the hospital, and much, much more. And this scene, I mean, this is what it means to live with the virus, and it's not sustainable. Healthcare workers around the world are crying out for help, and they're not passive. They're not just keeping their heads down and hoping the hospital administration or the trade unions or the government will suddenly jump into action. But rather, healthcare workers in line with the general class struggle are standing up and showing that they're ready to fight. I'll just go through a few recent developments of healthcare workers' recent struggles in the US. In September, 15,000 nurses across the state of Minnesota went on strike, demanding improved staffing and wages. The strike was called to a close by the trade unions without any improvement in conditions or no contract being reached. And just this week, it was announced that nurses have demanded another strike vote across the state, determined to reach their demands. In California, nurses at multiple hospitals have struck in the past year. I'm going to speak more about an important strike that took place at Stanford Hospital later. But I also want to note a recent struggle of 2,000 mental health workers at Kaiser Hospital, which is a major healthcare conglomerate here in the US, where these mental health workers are so short-staffed that they're not able to book return appointments for patients who are in desperate need of mental health care for 4 to 8 weeks after an initial visit. In Montana, the entire neurology department at a major hospital quit en masse, citing unsafe and untenable conditions, one of which was requiring physicians to see 2 patients every 15 minutes. In October, in Illinois, emergency room nurses arrived for their shift only to find that there were only 4 nurses to cover a 50-bed emergency room. These nurses bravely refused to work unless additional help was found. When no help was found, the nurses were walked off the premises by security and fired. Hundreds of nurses rallied the next day to protest this action. Healthcare workers are not alone in their struggle, and behind their growing opposition is the massive growth of the class struggle, which is itself a fundamental driver of this political crisis and instability. The opposition of the healthcare workers draws strength from the fact that it's part of a much broader movement of the entire international working class. And here I'd just like to briefly touch upon some of the developments among the working class in the US, which has been touched on by other speakers. Nationally, there is a potential for 120,000 railroad workers to strike. Despite the efforts of the Biden administration to force through a sellout contract, 3 out of 12 rail unions members of 3 out of 12 rail unions have already voted it down, with many rank and file members demanding to strike. Just this Monday, 48,000 academic workers in the University of California system went out on strike to demand wages and benefits that keep up with inflation. In the United Auto Workers, of which the UC academic workers are also members, Socialist auto worker and presidential candidate Will Lehman is winning a significant support on the platform of abolishing the bureaucracy and putting workers in control, which I'll speak on more in a moment as well. Also in recent weeks, tens of thousands of pilots across many major carriers have voted to reject sellout contracts or authorize strike action. Anger and frustration is also building among 20,000 West Coast dock workers who have been kept on the job for months after their contract expired through the collusion of the ILWU union with the port operators and the White House under a quote no strike deal. Major battles are just over the horizon in other industries as well, with national contracts set to expire next year for auto workers at several different major auto plants like Ford and GM, and for 250,000 United Postal Service workers. And developments in the United States are part of a world movement, as this meeting indicates. And workers, as we can see, have launched strikes in French oil refineries and British railroads and ports. Last week, educators in Ontario, as was already mentioned, launched a province-wide strike, which won significant support from workers across that country. In all of these struggles, workers are not just confronted by the corporations or the Democratic Party, but by their own trade union bureaucracies, which many workers have come to recognize are tools of the companies and the government. This has found a very conscious expression and overt expression in Will Lehman's campaign for UAW president. Lehman, who is a trucks worker from Pennsylvania, he's running on a platform of calling for the abolition of the pro-corporate UAW apparatus and the transfer of power to rank and file workers, who are the ones who produce the wealth and pay the dues. He is assisting workers in building rank and file committees in the factories and other workplaces. And these rank and file committees, as has been described, make up an interconnected network of committees which seek to organize a united counteroffensive against inequality, exploitation, and the homicidal response of the ruling class to the COVID pandemic. In the US, rank and file committees have played a crucial role in the struggle of healthcare workers. One such example I'd like to speak about was the experience here in California with the strike of 5,000 nurses at Stanford Hospital, which is a major, academic medical center. And this strike took place last April. Nurses were in a very powerful position after 5 days of striking, when the strike was abruptly called off by the union called Krona, who rushed through a sellout deal, violating its own bylaws by calling for a quick vote, angering many nurses. Our rank and file committee at Stanford played a key role in changing the course of this struggle. Throughout the strike, one of the nurses in our committee wrote a diary of a striking nurse series of articles which were published on the World Socialist website and which expressed the mood of nurses on the picket and following with the betrayal by the union. The day before the vote, the snap vote, nurses had still not received the full tentative agreement. And it was our committee of nurses who rallied nurses and pushed to demand the full agreement, which was then reluctantly given to the nurses the night before the vote. The morning the strike was called off, the rank and file committee of nurses quickly organized a meeting to discuss the betrayal and the way forward. This meeting was attended by over 60 nurses on short notice, nurses who expressed shock and concern over the way they had been treated, lamenting the fact that the new contract did nothing to address their needs, and seeking answers on how to move forward. This experience showed our committee and many nurses who followed the struggle closely that no one is going to defend the nursing profession except nurses. Healthcare workers want to fight, but this fight is not just against the individual hospitals that we work at. Our committee was founded in the defense campaign of Redonda Vaught, a nurse in the US who was unfairly criminally charged in the death of a patient in the context of a hospital that lacked standard safety stops and was horribly understaffed, conditions that nurses face in hospitals across the country. Our committee was on the ground at major rallies that were held in her defense in the Capitol in Washington, D.C., and present at her trial in Tennessee or in North Carolina, writing daily updates and reports. The World Socialist website was receiving hundreds of write-ins on a daily basis from nurses across the country coming to her defense. And the defense of Redonda Vaught was much more than just the defense of an individual, but it really came down to the question of the healthcare system, which is scapegoating nurses for their own crumbling infrastructure. Who is going to defend healthcare workers? No hospital CEO, no government official, but no one except the working class themselves. This is the basis that our committee was founded on. Mass anger exists among nurses and other healthcare workers. We see this every day in our conversations with workers, in write-ins to the World Socialist website, and in conversations with workers on social media. but the role of the committee is to raise the question of removing the profit motive from healthcare and fighting for socialism, because it is the capitalist system that is creating these unsafe conditions. Conditions where hospitals are closing when they're needed most, where nurses are leaving the profession in droves, where physicians are leaving the profession in droves, where healthcare workers are committing suicide and patients are dying in emergency room waiting rooms. This meeting itself is also an expression of this situation, proving that this crisis cannot be solved in a single country. The staffing ratios, the needs of patients, the demands of workers, these are the same in hospitals across the world and must be fought for internationally. So thank you again for inviting me to this meeting, and I look forward to answering any other questions in the question and answer period. Thank you.
Thanks very much, Katie. And our next speaker this afternoon is Craig Wallace. Very pleased to welcome Craig this afternoon. He is a prominent disability activist who's led campaigns for the Disability Royal Commission and for the funding of the NDIS, the National Disability Insurance Scheme. Craig is also a spokesperson for Australians Against COVID, which is a grassroots collective of groups and individuals who call for COVID protections of people with disability, people with chronic health conditions, immunocompromised people, older Australians, and those who are otherwise impacted by COVID. So a warm welcome to you, Craig.
Thank you, Patrick. It's great to be here. I'd like to start off by acknowledging that I'm joining you from the land of the Ngunnawal people here in the ACT, and that this land was stolen and never ceded, and also that the pandemic represents an act of violence against both disabled people and Aboriginal and or Torres Strait Islander people. I also want to offer a moment of silence, respect and condolence to the nearly 16,000 Australians who have now died from COVID-19 and the millions who have died or become disabled around the world. Those people were the unemployed, the poor, the homeless, queer people, frontline healthcare workers, teachers, the old, the frail, the sick, the immune compromised, and disabled people. Our friends, families, workmates, and leaders, including here in Australia, have been sacrificed to a preventable disease, which has been allowed to spread for reasons of profit, opportunism, lies, conspiracy, and political cowardice. This is social murder and it is eugenics. This is a slow homicide of the unwanted as casualties in a fog of war by pandemic. And just like a fog of war, they seek to silence us on platforms, in committees, and in parliaments. I am a proud disabled person, and we sit alongside others at the front line of this pandemic. In the UK, nearly 60% of the people who died from COVID-19 had a disability. Britons with disability are 3 times more likely to die. People with an intellectual disability are 3 to 5 times more likely to die, and children with intellectual disability are more likely to wind up in hospitals. In the United States, fatality rates are higher for people with intellectual disabilities compared to people who are not disabled. In Canada, studies have shown that people with Down syndrome died at a rate 6 times higher than those without intellectual disability. In South Korea, the odds of death from COVID-19 infection was 6 times higher than most disabilities compared to non-disabled people. Here in Australia, they keep trying to hide the data, but we know the toll is high. There have been over 25,000 cases reported amongst NDIS participants. There have been 4,000 deaths in residential aged care. Disabled people and older people face a triple jeopardy in this pandemic. Firstly, a high risk of death. Secondly, a return to segregation and seclusion by pandemic. And thirdly, one disability on top of another, which tips people into nursing homes, acute care and crisis. Day after day, governments have sought to minimise the impact of COVID and to gaslight our communities. State premiers held daily press conferences where they sneered and scoffed at the deaths of older Australians and disabled people as coming from underlying health conditions, as if being disabled was a crime or a sin inflicted by an angry God. We were left behind in the responses. We were the last to be vaccinated. They claim that the antivirals will protect the vulnerable, but access to the antivirals is much more complicated than it appears. It's entirely unclear who is eligible for the 5th dose, despite them claiming again and again that these things are clear. But it gets worse. Long COVID represents a major and fundamental health challenge, threatening to become a mass disabling event on a scale equal to HIV, polio, and World War II. Based on infections so far, 400,000 people are likely to be left with disabilities due to COVID, with over 100,000 people with a serious disability and 300,000 people with activity limiting disabilities. These are figures from the Actuaries Institute of Australia, and I suspect it's probably the first time they've been quoted in a conference like this. The World Health Organization estimates that 10 to 20% of people infected with COVID will experience ongoing symptoms. If you get long COVID, join our struggle and our organisations, but don't assume that the support will be there if you are disabled. It is no accident that the pandemic has seen governments attempt to dismantle the NDIS by independent assessments. Government have failed to raise the base level of income support. People on New Start cannot afford to rent a house, and people on a disability support pension are dying of pneumonia because they can't keep the house heated. They are banning the drugs like Panadol that people need to make their lives tolerable. They hope that we can't protest, that we can't gather, that we can't speak out, and we need to prove them wrong. They do these things and they do not mourn us because they don't care and they do not miss us. Governments and others have spent decades vilifying and attacking welfare recipients and disabled people, describing us as leaners, burdens, and the NDIS as unsustainable. It's social murder. It is a slow war on the vulnerable. This is eugenics. This is an attempt to remove a class of people judged as inconvenient and costly. This is also an attempt to return disabled people to the attics, to the basements, to the institutions, and the hiding in isolation that was our experience of life for decades. Now, none of this, not all of this is intentional. I'm not a conspiracy theorist, unlike the fascists that have been allowed to dictate our health policy and wander around our cities, including my city of Canberra, threatening violence against elected officials day after day. I will be criticised for speaking here today, but I do not care because we are in a life and death struggle. In that struggle, disabled people should look without reservations of any kind to the political allies prepared to resist the sacrifice of our lives. In the work of Australians Against COVID and the organisations that we are allied with, we've asked for key things to turn this around. We want a public commitment from all governments to end the current uncontrolled transmission of COVID in Australia. Those of us at risk should be invited to address National Cabinet, including workers, aged, disabled and immune compromised Australians, and those with long COVID. We need to stop requiring disabled and immune compromised people to risk a deadly infectious disease to access work, education, medical care, and essential services. No one who is disabled or at risk should be required to attend Centrelink or mutual obligations, or to maintain a social housing, tenancy, licenses, access to utilities, or to undertake banking. These things should be mirrored online. Rights to work and study from home should be mandated by law. We shouldn't have to choose between retaining our lives and our bodily integrity or retaining an income and education. We need support to ensure that we can access places like doctors and dentists that we need to carry on, and to do so safely with masking, air filtration, and social distancing. Governments and employers should be prevented from using COVID as an excuse to transfer the cost of maintaining safe workplaces to vulnerable people. They should make a contribution to the costs of online access for home-based study and for work. After all, we gave up our lives to keep the cafes open. We need funded supports and community development for those of us who have been left abandoned in our homes for years. Long COVID should be recognised as a disability with access to income support and the National Disability Insurance Scheme and early intervention. As COVID worsens, and it is, we need a guarantee that disabled, sick, and immune-compromised people will not be left to die in the corridors and car parks of overloaded hospitals as a form of involuntary euthanasia. Frontline healthcare staff should be resourced to treat those in front of them, regardless of disability or other health status. Lastly, a national memorial and 1 minute silence in Australian parliaments should be observed to respect those who have died from COVID. We've done this for other things, whether it be victims of terrorism or of wars. We should be recognising the victims of COVID. Australians Against COVID thanks the Socialist Equality Party for providing us with a platform here. We call on disabled people, allies and friends to join us in converging on the Australian Parliament on Monday, the 28th of November at 12:30 p.m. for a socially distanced, safe and peaceful action to make it clear that the grassroots of disabled people are not prepared to sacrifice our life to COVID and its mismanagement. Thank you very much for listening. Happy to take questions later on.
Thanks very much, Craig, for that powerful contribution, and a warm welcome to other members of Australians Against COVID at that meeting. I think the remarks you made in particular regarding the concept of social murder are entirely apt. That was raised, I believe, in early 2021 by the British Medical Journal in an editorial denouncing the British government's response. The term itself, social murder, was originated by Friedrich Engels in 1845. I just found the source of that. I just put that in the chat box. He was writing in his book, The Conditions of the Working Class in England, and Engels raised, quote, "When society places hundreds of proletarians in such a position that they inevitably meet a too early and unnatural death, one which is quite as much a death by violence as that by the sword or bullet, when it deprives thousands of the necessaries of life, places them under conditions in which they cannot live, forces them through the strong arm of the law to remain in such conditions until that death ensues, which is the inevitable consequence, knows that these thousands of victims must perish, and yet permits these conditions to remain, its deed is murder, just as surely as the deed of the single individual. Disguised malicious murder, murder against which none can defend himself, which does not seem what it is, because no man sees the murderer, because the death of the victim seems a natural one, since the offence is more one of omission than of commission. But murder, it remains." Very apt quote there. So thank you again, Craig. We look forward to hearing further from you in the discussion period. Our last speaker this afternoon, before we open up the meeting, is Sue Phillips. Sue Phillips will be well known to many of us here this afternoon. She is the national convener of the Committee for Public Education. She is a primary school teacher herself. She's also a member of the National Committee of the Socialist Equality Party. She's a regular writer for the World Socialist website, writing on a range of issues, arts and cultural issues concerning the Indigenous peoples, as well as primarily that of the crisis of the public education system, as well as the impact of the COVID pandemic in the schools. So a very warm welcome to you, Sue.
Thanks, Patrick. I'd also like to welcome everyone to this meeting from across Australia, and of course our people that are coming in from internationally. I'd also like to thank the speakers so far for their very powerful contributions. On March the 18th, 2020, now nearly 3 years ago, the Committee for Public Education made our first statement calling for the closure of schools and the formation of action committees to defend the safety of educators, students, and parents, and all those in the community. This was the first of many published statements and articles. Our perspective was based on the urgent need to protect lives under conditions where COVID began spreading internationally and here in Australia, with thousands becoming ill and dying. Many will remember scenes in New York of mass graves, people in Italy dying on trolleys outside hospitals. These images sent shockwaves across the globe. The standpoint of governments globally, however, was, as we described at the time, quote, malign neglect. The priority of governments was to defend the wealth of the financial elite and the profit interests of business, with the death of millions of ordinary workers seen as little more than collateral damage. This fundamental division, an irreconcilable conflict between the demands of the financial elite versus the health and safety of workers, continues and has deepened as the catastrophe unravels with the adoption of murderous let-it-rip policies internationally, with absolutely no end in sight. Everything that we warned about has been vindicated in the tragic deaths of millions across the globe, with unknown numbers suffering long COVID. In February 2021, just 1 year into the pandemic, and Patrick just mentioned this, the British Medical Journal aptly described the role of governments as, quote, social murder. This was a phrase, as Patrick said, coined by the Marxist Friedrich Engels in 1840, describing the power of the privileged classes creating conditions for premature death among the poorest classes. The BMJ editorial was titled COVID-19 Social Murder and was written under conditions where 2 million people had died worldwide. Now the figures are more than 20 million. Murder, the editorial began, is an emotive word. In law, it requires premeditation. Death must be deemed to be unlawful. How could murder apply to failures of a pandemic response? The journal then goes on to argue that the term is entirely appropriate, as Craig said. When politicians and experts say that they are willing to allow tens of thousands of premature deaths for the sake of population immunity or in the hope of propping up the economy, is that not premeditated and reckless indifference to human life? When politicians willfully neglect scientific advice, international and historical experience, and their own alarming statistics and modelling, because to act goes against their political strategy, is that lawful? Is inaction action? When the pandemic began, which had been warned of and anticipated by scientists and health experts, and then criminally ignored by governments, there were not even basic safety measures in workplaces and schools, and in some cases, not even soap in schools. Workers everywhere were to discover that it was not just governments which adopted such policies, but all establishment political parties and the unions. Within weeks, teachers' opposition began with petitions calling for the closure of schools and walkouts. Resolutions were passed demanding the union do something to defend educators. There were threats of mass resignations, and at Footscray High, a resolution was passed by Will Marshall, a member of the Committee for Public Education and the Socialist Equality Party, for the formation of a rank and file committee This was a part of an international upsurge of workers with wildcat strikes in auto in the US, in Italy, bus drivers in the UK, and in warehouses and other workplaces here. In response, and fearing that strikes may break out of the control of the unions, and with the threat of hospitals being overrun, governments reluctantly implemented lockdowns and schools went to online learning, although that was not the case in every state. Such was government fear that Morrison established his unconstitutional bipartisan national cabinet in which Labor were the majority participants. And at the same time, in March 2020, he secretly took joint control of at least 5 key ministries, aggregating power over health, government finances, industry, and the police and the intelligence apparatus. The overriding concern was to suppress opposition by workers, educators, and health professionals as the pandemic spread. As Morrison declared in August this year, defending his grab for power in 2020, he said, quote, "The prospect of civil disruption, extensive fatalities, and economic collapse was real," end of quote. In addition to extra parliamentary measures, Morrison turned to the teacher unions and the ACTU, in particular, Sally McManus, to suppress opposition. In March, McManus was meeting with Christian Porter, the Industrial Relations Minister, on a daily basis. Morrison personally rang McManus and expressed his appreciation, and Porter told the Australian newspaper that he was now BFF, best friends forever, with McManus. Morrison also publicly thanked the Federal Australian Education Union bureaucrats after cordial meetings, stating, quote, "We are working with the National Education Union. I thank them for their cooperation today and the very good spirit that they and many other unions around the country are working together with us." Fearing a developing crisis, lockdowns took place and were initially effective in suppressing COVID in the community and to zero. Throughout 2020-21, the demands of the financial elite intensified to open up the economy. Ex-Prime Minister Tony Abbott summed up the position of the financial elite when he slammed the Andrews Labor government lockdown, saying it amounted to, quote, "a health dictatorship," end of quote. For the economy to be opened up, educators had to be forced back to face-to-face learning. This was the key to the government's strategy, not in the interest of educating children or their mental health, but to force their parents back into the workplaces. Educators were told schools were safe. Social distancing, while it applied in the community, well, for a time, was supposedly unnecessary or inappropriate in schools. Children apparently didn't transmit the virus. It was only adults. And if children were affected, it was mild. All of this was required in schools initially. All that was required in the schools initially was a bit of cleaning. Teachers and parents were emotionally pressured by unsubstantiated claims that online learning affected children's mental health. The fact that a child had a family member or a grandparent that may have died, that supposedly didn't impact on their mental health. Even in July this year, when Albanese was asked why he rejected mask mandates, he absurdly claimed mask wearing by children had, quote, "mental health considerations." The imposition of controls on people's behaviour has an impact on people's health, and particularly young people. We're seeing a really problematic increase in incidents of severe consequences. The teacher unions never challenged this lie, where all international research has shown that the schools are vectors of the virus. From the beginning, the union has acted unquestioningly as messengers, servants, and policing government dictates. The World Socialist website has described the pandemic as, quote, a trigger event, bringing to the surface, uncovering economic, social and political conditions that have been developing over the previous period. This is certainly the case with schools. The appalling situation in public schools with overwhelming workload, inadequate funding and resources, mounting staff shortages, teacher burnout, stress and poor wages. All of this existed before the pandemic, but has been totally exacerbated, accelerated 1,000 times over by COVID. The Labor government has now intensified this situation. Educators have shown a willingness and determination to fight against these conditions, but have been straitjacketed and betrayed by the unions. This is experienced for educators internationally. In Victoria, at the end of September 2021, 97% of educators voted for strike action for a new agreement on wages and conditions. At the end of November, Omicron began emerging in Australia and spreading. Independently, the Committee for Public Education was collecting data of school infections and clusters, posting figures on a daily basis. We became the focus, with thousands of parents and teachers providing us with information, accessing and sharing our data as the real situation was being buried. In December, New South Wales educators took strike action over wages and working conditions for the first time in more than a decade. While educators in New South Wales and Victoria were fighting for a new agreement and facing the same terrible conditions, they were kept isolated and separated by the unions. In an attempt to silence teacher anger in Victoria, the AU State Council stated that they would consider industrial action beginning in 2022. Behind the scenes, Andrews and Perrottet were devising a plan to get the schools open after the summer break. They understood Omicron would be spreading out of control in the schools at the beginning of term 1 in 2022. Now, we'd like to just show a short video, part of a video of Perrottet explaining their agenda at a meeting of business, and it was to the Committee for Economic Development in Australia. This is Perrottet.
The relationship with Dan Andrews, for me, was going to be a particularly important one. I get criticised for being the open up guy. He gets criticised for being the lock it down guy. So if we could somehow work together and have similar settings in place, the ability for the media to criticise and instill fear in the community based on the approach that we were taking, we would take that off the table. So it was a strategic plan for both of us to mirror our settings where possible. That has proven to be incredibly successful, because I think when you've got, particularly in the media, on any decision the government makes, it was the most ironic one I thought was, we ended up bringing QR codes back when we weren't even tracking and tracing. There was no science behind it at all. It had zero utility, but there was a massive campaign, and when those massive campaigns get run, what it does, it depletes confidence. And that kind of reporting, as we've seen over this period of time, has depleted confidence in our people. So we actually brought it back for one reason only, to instill confidence so that people would go out with using QR codes. But where Dan and I reached that agreement was, if we could come out on the same day with the same settings, whilst he would get attacked for not going far enough, and I'd get attacked for going way too far, we could work with each other to say, well, go look at Victoria, and he could say, go look at what Dom's doing in New South Wales. And it worked perfectly. I think that relationship, particularly with schools going back, where we reached agreement on schools. I mean, when we announced schools going back, the media would rush to find the scariest epidemiologist who was out there saying every child across New South Wales would die. And that was a problem, because we had to instill confidence. So what did we do together? We agreed that we'd go and get all these rapid antigen tests, which was a massive feat.
As Perrottet admits, and that was, they were meeting in December, him and Andrews, the plan was not based on health advice, but a blatant political manoeuvre to, quote, as he said, instill confidence, and to quote, and damp down teacher unrest and parent concerns. In January, just a month later, 2/3 of teachers in South Australia voted for strike action because of lack of COVID safety in their schools. Desperate to head off the possibility of educators in 3 states striking at the same time at the beginning of term 1, the South Australian Education Union called off the strike. The New South Wales Teachers Federation proposed no action for term 1. And then in the first week back of the school year, the Victorian AU suddenly announced that they'd signed a deal with the Andrews government, fraudulently claiming a victory on wages and workload, with all action to immediately cease. Now, the Vic AU agreement, in fact, was a monstrous betrayal. The supposed 2% wage amount amounted to a massive wage cut under conditions of escalating inflation and rising interest rates, and with the deal on workload amounting to little more than hot air. The Committee for Public Education politically analysed and led the campaign for a no vote, fighting for rank and file committees. And as a part of that campaign, we established a Facebook group of nearly 900 educators, providing the opportunity for them to discuss and share information that was being bureaucratically censored by the union. The anger among educators, however, has not subsided. Throughout this year in New South Wales alone, there have been strikes of teachers both in public and independent schools. Early educators and TAFE teachers have taken strike action, and there have been dozens of strikes and protests among university workers. In all these disputes, COVID is virtually unmentioned by the highly paid and privileged union bureaucrats. Last week, the Industrial Relations Commission in New South Wales brought down a wage deal for teachers, which amounted to a wage cut. Angelo Gabrielatis, the New South Wales Teachers Federation Union President, with an annual salary of benefits of over $250,000, declared after the IRC ruling, quote, the March election, and he's talking about the state election coming up, will be a vital test of which party has a plan to address the real causes of the teacher shortages and secure the teachers we need for the future. In other words, teachers are being told to accept the wage cut and in March 2023 vote for the Labor Party. There is in fact no substantive difference whatsoever between the Labor and Liberal parties on the agenda of slashing spending on public education, increasing millions of dollars into the private schools, and creating one of the most unequal education systems in the world, and imposing pedagogically regressive measures, in particular in the public schools. Significantly, the New South Wales Teachers Federation has been silent over 2 other Industrial Relations Commission rulings this year. That is the fining of the union a total of $90,000 for the so-called illegal 24-hour strikes in December and May and other limited action. Similar fines have been imposed on the health union, but both unions have accepted the fines without informing members, fundamentally agreeing with the anti-strike legislation, and will use the threat of penalties as a pretext to shut down future strikes. If there was any conception that the election of a Labor government would alleviate this situation, the last 6 years of the Albanese Labor government has proven mistaken. The dismantling of all safety restrictions has seen a major spike in infections. Like hospitals, schools have become unbearable. In addition to COVID absences, schools nationally are reporting unprecedented numbers of unfilled teacher vacancies. Classes are not covered, often combined or collapsed. Emergency teachers unavailable, specialist teachers covering tutoring or special needs students taken out of their area expertise and covering for absent teachers. Reports are now emerging of principals being directed by the education departments to hide the truth about what is happening, and students and staff who have tested positive are being now encouraged to attend school if they're not too ill. A recent survey by Monash academics found that 59% of teachers were planning to leave the profession. As Julia has explained, the central call of the Health Rank and File Committee and the Committee for Public Education has been for the formation of rank and file committees, fighting for power to be put back in the hands of workers. Democratic organisations where decisions about safety and working conditions are not dictated from above, but democratically discussed and decided upon without the suppression and censorship of the unions and employers. Committees organising unified action in the schools, universities, hospitals and other medical workplaces against the new stage of COVID aimed at advancing workers' interests, putting lives before profit. In conclusion, I would like to encourage everyone here to participate as widely as possible in this discussion. But above all else, join our committees as the first step to organising a rank and file committee at your workplace. At every stage, our committees have politically analysed and exposed the criminal policies of governments. We have provided a voice and a way forward to educators and health workers. The problems we confront are international, and therefore we stand with and are proudly a part of the International Workers' Alliance of rank and file committees, unifying workers on all continents engaged in struggle. Thank you.
Thanks very much, Sue, for that report on the situation confronting the public education sector here in Australia. We do wish to now open up the meeting. I would encourage participants to pose any questions that you now have. You can use the chat box to do that. We have an opportunity to pose questions to the speakers today. That includes Katy Kinner from the United States. So if there's any aspect of her report on the situation in America, including the struggles waged by railroad, auto workers and nurses, feel free to ask. We have Craig Wallace speaking on the questions particularly concerning disability, as well as Julia and Sue on the questions of the health and education systems. So if you have any questions now, please feel free to use that chat box to do that. If you wish to speak, you can raise your hand. Just while you're thinking of formulating questions, I will just read out a couple of comments that were put in the chat box. Earlier, we had Sally let us know that she needed to leave. She has work this afternoon. I've been called in early. It's a regular request to most staff lately. I'm in aged care Perth, Western Australia. We had 2 positive cases Friday a week ago. By Sunday, we had 13 residents test positive and 2 staff. So that's another indication of the disaster that's continuing to be wreaked within the aged care sector. We also had an important message from Steve in New York City. I don't think I'll read that out again, but thank you, Steve, for sending that. Okay, Sam has raised his hand to speak.
I'm a girl, Sam. Thank you. So thank you so much to all of the speakers and to the organisers for organising this event. You know, it's actually really important for people with disability to know that there's solidarity from our health workers and from people who support us. You know, for so long, people have been silent. It's been really isolating for all of us. I'm one of the co-conveners of Australians Against COVID with Craig, and there are a number of other people here. I've recently stepped down as the president of People with Disability Australia at the peak national disability body, and our new president, Nicole Lee, is here in the room today. I just wanted to acknowledge her. I just wanted to say, you know, thank you so much for organising this event, but also can you please make sure that wherever you are, you make a noise. It's just so important that we have people who are speaking out. You can't say that you're on the side of human rights, that you're on the side of people with disability, that you're on the side of sick people, of immunocompromised people. When people say that they are supporting, they're fighting against mask mandates, or they're, you know, they have some sort of belief or view, what they're saying is that they don't think that our lives are important and that profit matters more. So I just wanted to encourage you to all call it out wherever you can, to be brave, to be passionate, to speak out as much as you can, because there are so many of us who are dying and becoming more and more sick right now. Thanks so much for your support.
Thanks very much, Sam, and apologies for misidentifying you there. Craig, do you want to respond to that or add anything to that?
Yeah. I would just make the observation that I think the assumption has been all through this is that disabled people have been crushed, buried, and silenced by the pandemic. For instance, that it's difficult for us to gather in groups, and so that means that we can't mount effective resistance against the things that are being done to us. Well, the campaign against the, horrific independent assessments regime that they tried to bring in just after the pandemic began on the NDIS, similar to the British terrible regime that was run by ATOS, a giant contracting firm that caused many people with disabilities to lose their lives and to ration care in the United Kingdom. They used the pandemic as cover for doing that. We need to show at the grassroots level that we can organise, that we can campaign, and that we can face off against those who are active, vocal, and present on the ground. Like in my city, we've had the QAnon far-right conspiracists having free run of the city now for about 2 years. We need to put our own footprint on the ground and be prepared to do whatever it takes to show the grassroots won't put up with this, and that's why we're calling for the action on the 28th of November.
Thank you, Craig. Mandy has a hand up. Again, feel free to ask any questions at all on any aspects of our reports to our speakers using that chat box feature. Just before Mandy speaks, I will just let people know that we've received greetings from Britain and the UK Educators Rank and File Safety Committee. So I'll read some of that out after Mandy.
Just thanks to all the speakers so far. Just what an important conversation we're having. I'd like to talk about the conditions in school currently, at least from my point of view. I'm a primary school teacher in Melbourne and I have been for over 20 years. And I've tried really hard to mitigate against COVID in my classroom with relatively good outcomes until now. I've been able to encourage many of my students to wear masks even after the mandate was dropped. But this is getting harder and harder now that the message is well and truly that COVID is somehow over. It does prove, though, that it can be done. Even when other classrooms were reporting cases, mine hadn't been, and I think that has a lot to do with the masks being really vigilant with ventilation and things like that. Teachers perhaps get a bad rap for complaining about our conditions, but there's a real reason why we're in the crisis that we're in. The teacher shortage has been growing for years, and that's true across the world, and it's been exacerbated by COVID. Workloads are untenable, and much of the extra work is not helpful for our students or teachers, which is really frustrating. The constant data collection, standardised testing and admin is making it increasingly difficult, especially for seasoned teachers who know better but are hamstrung by top-down policy tick boxes and data. And these conditions are worsening, and I think that's shared by educators across the globe and in different industries for all working class. Now, because of COVID, we're dealing with high absentee rates due to illness, and also because the wellbeing of kids and teachers has taken a real hit over the last 3 years. The pandemic has left teachers feeling a bit used and abused, to be honest. We were considered frontline workers and were asked to change the way that we taught in a second flat. And we chopped and changed from one mode of teaching to another and back again many times. And I lost count how many times we went back and forth from online, to teaching face to face. And it was a physical and mental load on teachers. I think we did it pretty well, all things considered, though. Then, despite rising cases in our communities, we were asked to go back to face-to-face teaching with kids with very little protections, despite the fact that everyone knows classrooms are petri dishes when it comes to germs and illnesses. This has clearly intensified the teacher shortage, and the effects are being felt every day. We have classes split due to a lack of replacement teachers. I've personally had up to 6 kids split from other classrooms into mine more days than not. We've had to collapse class, like at the beginning of the year, we had to collapse a whole classroom because we didn't have enough teachers. So that's meant that we've got classrooms with bigger numbers, and so those splits fall on myself and others as well. There are very few mitigations left. Teachers are believing the lie that COVID is somehow over, and apathy has well and truly set in. Many don't bother putting ventilators on. Very few teachers and students are wearing masks, and it makes people like me feel very unsafe in my position. I know that there have been close contacts at school. I've heard teachers speaking openly about that fact, and no doubt people are coming to school knowingly with COVID, as this is now allowed. And I will say, I don't blame individuals for their choices. There's absolutely no leadership when it comes to this. There should, at the very least, be mask mandates. When there was, all of my kids in my classroom wore them. I was able to remind staff to wear them during meetings, so it felt a whole lot safer. People who are aware of the dangers of COVID avoid places like restaurants because of the number of unmasked people. Teachers spend all day in classrooms with 20 plus unmarked kids. Secondary and specialist teachers move from one class to another, therefore adding to their risk. We have meetings in small rooms with high numbers of unmasked adults. This could be 100 people on a weekly basis. Staff sit in crowded lunchrooms, staff rooms for lunch on a regular basis, and attend assemblies with hundreds of people, and we don't have the choice to opt out of this. Excursions and camps are running now with long bus trips. The list goes on. It's all but impossible for parents to avoid COVID under these conditions. It's hard enough for me as an adult to be one of the very few wearing a mask at work. It's a lot of pressure for kids, even well-informed kids, to stand out in a crowd in a mask when it's not socially acceptable. As a parent of a VCE student, I've managed to avoid getting COVID at work against all odds, but I'm just now getting over a pretty bad bout of it, because my daughter brought it home from school. And I think it proves what we all know, that personal responsibility is an absolute fallacy. I've been quite sick for 2 weeks, and during that time I've been expected to send in my full work program in case I was covered. This means planning every single lesson in detail so someone else could teach my program. This is difficult when you're sick. I've also had to continue writing reports, and I know that this week when I return, I'm returning to a pile of assessments and data that I need to collect, and a whole lot of catch up that I need to do to prepare my reports and the lengthy documents for handover for 2023. All of this with the added stress of worrying about the effects of COVID, what might happen to my daughter and I, and how we're going to get through the next bit, avoiding other infections. My heart absolutely goes out to people with additional health needs, and the people we've heard from today with additional health risks. It's absolutely abhorrent that people have to live like this. So thanks to everyone for being here and being a part of the conversation, for everyone's contributions, and for joining together to spread awareness. We can't accept this, and I absolutely agree that it's up to the workers to take matters into our own hands. Thanks.
Thanks very much, Mandy. While you were speaking, Mandy, there was a comment in the chat box from Kate. As a teacher, I was arriving at 5:30 a.m, leaving 5 p.m. to 7 p.m. to go home to prepare for the next day. Apparently, I'm not committed enough. I quit, too unsafe in the classroom. Kate, if you'd like to elaborate on that, feel free to raise your hand to speak. Frank has raised his hand. I'm going to call on him in a moment. Just before I do that, I would like to read part of the greetings from Britain that we've received for this meeting. The greetings are sent by Tanya Kent, who's spoken at our public meetings previously. She's the convener of the UK Educators Rank and File Safety Committee, which, as the Committee for Public Education here, has fought for proper COVID safety measures in the schools. Likewise, that committee there has done so in Britain. Tanya writes, I would like to send the warmest greetings and support from the Educators Rank and File Safety Committee from the UK to your joint meeting today. In the UK, for several months, the largest strike movement witnessed since the 1970s has erupted. Workers across several key industries such as railways, buses, binmen, postal and communication, public sector, and university and college workers have engaged in a bitter and sustained struggle against a class war agenda. The Tory government's response to the economic impact of COVID and its full support for the war in Ukraine and the pumping of billions to fund it is resulting in mass impoverishment for millions of workers and their families. The health and education unions have blocked the calls by health workers and educators to join in this mass upsurge for months, have been forced to ballot for strike action, and the potential for the largest strike movement of public sector workers is now underway. The vote to strike by 300,000 UK nurses 2 weeks ago is a powerful show of opposition to entrenched low pay and appalling working conditions. Nurses delivered the largest ballot by the Royal College of Nursing in the union's 106-year history. The RCN, rather than announcing strike dates, is appealing to the government to enter negotiations so that it can jump on any renewed offer to end the strike. They are fighting for a pay rise of 5% above inflation. Many of the current strikes have been overturned by unions with well below inflation deals. 3 of the teaching unions are currently balloting for strike action. The largest union, the National Education Union, organised a consultative ballot of its members last month, claiming that they may not receive a sufficient mandate for action under the anti-union laws where over 50% of members must participate in the vote. Teachers returned a resounding yes vote for strikes of 63 to 68%. All education unions have now been forced to announce an official ballot. These, however, will not be coordinated strike action of near 1 million members, and the unions are desperately calling for negotiations to end the strike ballots before they've even been counted. The funding crisis in schools is catastrophic, threatening staff redundancies, larger class sizes, restrictions to the curriculum, and the elimination of support services. This is even before the government's budget was announced. School leaders in England revealed that half are considering teacher redundancies or cutting school hours to balance the school budget. 9 out of 10 schools expect to run out of money even before the next tranche of cuts arrive. Some 66% anticipate losing teaching assistants. Meanwhile, the COVID pandemic continues to rage. All mitigations have been removed, and the risk posed to the lives and health of millions goes unchallenged. Since March 2020, there have been over 24 million COVID infections and over 208,000 deaths. At least 145 children have lost their lives, as well as 570 educators. More than 3 million children have been infected with COVID in England alone. There are over 2 million people who suffer from long COVID, of which 98,000 are children. The teaching and education sector suffers the joint highest rate of long COVID of any sector at 3.79%. The education unions support the reopening of schools and have not lifted a finger to protect their staff and have not mobilised any action against this criminal setup. Your call to build independent rank and file committees in every workplace and school is essential, which must be linked to the campaign to build the International Workers' Alliance of Rank and File Committees, where workers globally confront identical conditions. We look forward to learning about the outcome of your discussions and continued collaboration. Tanya Kent, convener of the UK Educators Rank and File Safety Committee. So we're appreciative of Tanya for those greetings. I'll now ask Frank to unmute himself and speak.
Thanks, Patrick. I'm a member of the CFPE and member of the Socialist Equality Party, and I write for the World Socialist website on science issues and particularly on the pandemic. I want to concentrate my remarks on long COVID and children. So long COVID is a very little understood condition in general, but particularly in how it affects children. But what has emerged so far, almost after 3 years of the pandemic, is very ominous. we can judge a society by how it treats its most vulnerable members. Based on its treatment of long COVID in children, would lead us to conclude that this system has abandoned a whole generation of young people to what has been correctly termed a mass disabling event. The cautionary principle in medicine has been abandoned as governments around the world adopt a let it rip approach. The disaster that has emerged was not inevitable, as proven epidemiological methods have been shown to control the virus. It is a well understood phenomenon that all infections, viral and bacterial, have long-term consequences. So it's hardly surprising that long COVID has emerged. Yet when people started presenting with long COVID symptoms, they were routinely dismissed. Long COVID is the first condition that was identified by the many sufferers using social media platforms. The alarm bells were first raised in a medical fraternity by paediatrician Danilo Bonsenso at the Gemelli University Hospital in Rome. He carried out a study involving 129 children aged between 6 and 16 years who'd been diagnosed with COVID-19 in 2020 during the period of the Northern Italian coronavirus wave. He identified symptoms such as insomnia, fatigue, muscle pain, and persistent cold-like complaints. Even children who had experienced very mild or no symptoms during the initial infection suffered long-term impacts. Bonsenso estimated perhaps 5 to 10% of those with COVID-19 go on to develop long COVID. It's not clear how long the condition will last or what even longer term consequences may develop. For instance, the virus chickenpox can emerge decades later as shingles, a very debilitating illness. An article published by the World Health Organization related the experiences of Kitty McFarland, a 14-year-old child who got infected in March 2020. She was described as very fit previously, healthy, and enjoyed ballet, paddleboarding, running, and netball. And, you know, the interview goes on. Kitty remembers experiencing only cough and flu-like fever, but her mother, Sammy, who became ill with COVID-19 at around the same time, mentioned a terrifying moment when her daughter became unresponsive. Fortunately, these severe symptoms subsided after a few days and her health appeared to improve. About a month later, the pair attempted some very light exercise, but the relapse Kitty suffered left her bedbound for the next 8 months. And then just quoting Kitty herself, I mainly felt dizzy and exhausted. I would faint a lot and get heart palpitations. I could be just sitting around and my heart would suddenly leap to 190 beats a minute, said Kitty. She also developed a gluten intolerance and acute abdominal pain that caused her to faint and required several hospital stays. And then continuing Kitty's quote, sometimes I needed help to eat all my food. At other times I couldn't physically lift a glass because I was so weak, which is hard to admit when you were used to being strong and active, she recalls. Visual disturbances and brain fog meant that even watching TV or trying to text left her feeling nauseated and exhausted. Even though the emergence of the Omicron, that's the end of that quote, even though the emergence of the Omicron variants at the end of last year was greeted by health authorities such as the government chief medical officer here in Australia, Professor Paul Kelly, as a very good Christmas present, it has produced a heightened wave of infection in children and a new COVID cohort of long COVID sufferers. According to the American Academy of Pediatrics, 14,950,786 children have been infected in the US, representing 18.3% of all cases. If these figures are extrapolated internationally, this would be 114,760,000 children that have, can have long COVID. In the UK, 80,000 children have long COVID. Bonsenso related that even if long COVID prevalence turns out to be, say, 2%, given the hundreds of thousands of children who get COVID, it is still a very massive number. A paediatrician who runs a post-COVID care program at Yale New Haven Children's Hospital, Carlos Oliveira, commented that in some cases, children can sustain organ damage from their infection. It can invade the heart or the pancreas, causing conditions such as pericarditis or pancreatitis, where that particular organ becomes inflamed, which can lead to breathing problems and other long-term complications. And a recent important research that we've highlighted on the WSWS has shown that, the chances of getting long COVID are multiplied every time you get infected. So I think, what's shown by this is that a whole generation of children has been, unnecessarily exposed to an unknown future of serious disease. So, and I want to endorse the discussion we've had. Thanks.
Thanks so much for that, Frank. I should have raised this previously, apologies, but if everybody at this meeting can make sure that you leave your contact details with the CFPE and the health workers rank and file group, if we haven't already got them. It is a common experience in our campaign work that we speak with workers, others who agree very much with what we're raising, but say that they feel like they're the only ones that, in their workplace, in their community, the let it rip ideological offensive has had an impact. There's no question about that. This pressure that the pandemic is somehow over or resolved does make itself felt. And the way to combat that is to firstly continue to read objective medical scientific information, including through the World Socials website and its workers' inquiry into the pandemic, as well as keeping in touch with those of us who understand the real situation and collaborate in developing this campaign moving forward. There is a question to Katy, and that is, hi Katy, thank you for your contribution. I was wondering if the committee at Stanford is still active. Also, could you give a picture of the issues that have emerged on other such committees? That's from Will. So do you want to take that now, Katy, or speak later?
Sure, I can take that now.
Thank you.
To the first part of your question, I mean, we still have, a close contact from the Stanford committee, although the committee is not active on kind of a daily basis. However, I think while there might be a lull right now, these Stanford workers have certainly gone through quite an experience and are still facing the terrible conditions that they were, facing before the contract was reached. I think that's important. The conditions have not changed. In fact, actually, I mean, they've really gotten worse. We've heard from workers that the COVID patients are now allowed on all units. They're under precautions, but that doesn't stop, a patient with COVID being on an oncology floor, a cancer floor, where, patients are severely immunocompromised, which is obviously very dangerous. In addition, staffing shortages are worse than they've been. And nurses are being pushed, there's no mandatory overtime at Stanford, but nurses are certainly being pushed to pick up as many shifts as they can from their coworkers, praised by management when they pick up. Nurses are being burned out, at much higher levels. So the issues have not gone away. And certainly these nurses have gone through a very sharp experience in the last contract struggle, which is still with them today. So that's the first part of your question. I'm sorry, what was the second part of that question?
I think it involves the work of other rank and file committees.
Well, I mean, I can speak more generally about sort of our national rank and file committee and the work of that committee. I mean, a lot of very important kind of articles have been written based on discussions that have come up in our committee meetings. Nurses reporting, you know, suicides of other nurses. There was a nurse who killed themselves on their shift at a hospital in Northern California. There were, you know, then actually a patient suicide at another hospital where staffing was so horrible that the patient was allowed to walk, you know, was not noticed walking out onto a balcony and tragically jumping off. And then a lot of conversations really about the state of mental health care, not only for nurses after the tragedies that they see on a daily basis, but also of patients who are not able to get important mental health care and then end up, you know, in a situation in crisis in the hospital where they really aren't being able to be taken care of. So those were some of the kind of actions of our national committee. In addition, you know, we're working on a lot of exposures of the hospital closures, in particular, a lot of hospitals in more rural areas, which aren't lucrative enough and are shut down, leaving, you know, entire communities hours and hours away from medical care. So hopefully that answers some of your questions.
Thank you, Katy. There was another question from Margaret. I think you may have already touched on this, but if you wish to elaborate, the question is, can Katy explain the dangers nurses face of repeated infections from COVID, given that reinfections worsen the chances of contracting long COVID?
Sure. I mean, off the top of my head, I don't have the science and the scientific evidence, but I do know from sort of anecdotally that there have been many reinfections of nurses I've worked with. I worked with one nurse who was actually in the ICU for 3 weeks and now has chronic lung damage. She has a hard time making it through her shifts and has to use, you know, multiple types of inhalers to breathe properly and speak full sentences without coughing. It's really tragic. So I don't know if I can speak exactly on the damages from repeat infections, although I do know that that is the case, that there are these repeat infections can do much more damage. And I know, of course, as well that the damage that it can inflict on just every organ of the body. And I know that someone was just speaking on this a moment ago, but even, you know, relatively healthy younger people and can have after a COVID infection can then have some underlying, you know, cardiac issues that perhaps they don't even notice until months or years later. And certainly the issue, you know, I know the issue of chronic illness, which long COVID is just one of. You know, these are issues that have been around, of course, before long COVID. These post-viral illnesses can lead to, you know, chronic fatigue and POTS syndrome, just to name a few, which are extremely damaging, make it impossible to, for some to get through the day, to get out of bed even. These are often really just disregarded as well by the medical system. I wouldn't say by to the fault of healthcare workers, although certainly there are some who are ill-informed on the subject. But I know that, you know, people with chronic illnesses seeking care are often written off as having sort of having it be a psych issue, for example, as opposed to real physical symptoms that they're experiencing. So that's not really answering your question on sort of the how repeat infections affect healthcare workers. I just know that that definitely does affect the general population and that those symptoms are devastating. And I wrote actually a lot on long COVID earlier in the pandemic. And I know that kind of hope that there's this hope, at least, that perhaps long COVID can push forward the research on these kind of post-viral chronic illnesses, which were affecting people before the pandemic, And I know that there are these clinics that are open, you know, to help people who are suffering from long COVID and aren't getting the medical care that they need. But I also know that there's extremely long wait times in the US, and I bet it's similar in Australia. I heard one story about a nurse, or sorry, about a person suffering from long COVID who arrived to their appointment they'd been waiting months for, only to find out that they were actually a year early, and they had to wait another year to be seen at this clinic when they can't work. They're stuck at home, disabled by this virus. So anyway, I guess I just wanted to speak a bit on long COVID, but perhaps someone else can better answer the question of the science behind reinfections and the propensity to develop long COVID.
Yeah, thank you for that. Before we begin to perhaps move to the concluding section of the meeting, Sue is going to read a couple of remarks from the United States. But first, Craig, you've added some information on long COVID in the chat box. There is a question from James to you. What happens to people that already have dysautonomia, I hope I've pronounced that correctly, if they get long COVID?
Well, what will happen is that they'll probably try and say it is the dysautonomia or another disability that is causing the symptoms. There's a phenomenon in our community called diagnostic overshadowing, and that is where people with disability present to a hospital or an acute setting, often with quite, you know, profound symptoms and issues that have nothing to do with our disabilities, and they try and pass those off as a consequence of disability. We've had people with paraplegia who've had things like bowel cancer or, you know, chronic dental conditions, but they've been unable to speak and communicate, and they assign those symptoms to the disability rather than to the underlying condition. And they're going to go to town on this with COVID unless we stop them. So we really need a research agenda around long COVID. It needs to be discreetly identified as a disability. We need to tackle some of the issues where, you know, all of our disability support systems are designed around checklists and, you know, sets of assessments that allow non-medical workforces to make decisions about what is a disability, which often rules out invisible disabilities or allows another disability to be diagnosed as the main issue. So I don't have an easy answer, but this is going to be another issue that has a political dimension on top of a medical dimension, and for which we will have to fight. What we do know, it is the disabilities that are disputed and that remain untreated and undiagnosed that wind up the ones that have a great human cost at the end. Autism is a spectacular example of that, but I can think of many others, and we don't want that happening with the hundreds of thousands of people that have been sentenced to get long COVID by governments and health authorities in Australia.
Thanks very much, Craig. Sue?
Thanks, Patrick. I just want to refer to some of the comments that have come in from our international comrades who are part of the educator rank and file committees that are developing internationally. I've just received, I just want to read, and I noted that Steve from New York has made an important comment, and what we can see in these comments from our comrades in New York, Daniel in Ontario, and we have a comment from Renee in California. And I just wanted to read, she's listening in but is unable to speak at this time. Renee is a part of the West Coast Educators Rank and File Committee, and she organises the work of the Educator Rank and File Committees nationally in the United States, and has spoken at several of our meetings. She says that, and I'm just sort of paraphrasing some of what she's written very quickly, she said, I think it's important to raise the timeline and fight against educators in opposition to the responses to COVID. and the role of the Committee for Public Education, the SEP. She said, hang on. She said, the Educators Rank and File Committee at the moment in the United States is gathering testimony through surveys amongst educators, staff, parents to get more information. And she says some of the responses are just absolutely devastating. She said, you know, in addition to COVID, there's mass increase in respiratory and flu cases amongst young people, tripping through daycare and the schools. And of course, as Katy has emphasised, is impacting on the hospitals. She pointed to the fact that they got one report from a parent who said that someone in her child's class had a respiratory failure and has now got brain damage. And she also emphasised that the transition from zero COVID strategy in China is immensely ominous. And this clearly shows a looming catastrophe that's going to take place throughout the country in China, but of course the schools. And this really underlines the importance of a global elimination strategy that we've been fighting for. She also points to the latest dispute amongst University of California academic workers who are in strike at the moment, and the educator committees and the party and the SEP is intervening into this situation, making connections with these sections of workers who are part of the UAW, and of course in connection with our campaign around Will Lehman. Steve also sent some greetings from New York, the New York Educators Committee, and I'll just read a little bit what he said. We really welcome these comrades to our meeting. He said, thank you from New York City to the Australian healthcare education rank and file workers for showing a way to unite, which can be a model to workers internationally across the economic sector. I just wanted to note that the attacks in New York City on the healthcare plans of educators and all other city employed workers, active and retired, combines with budget cuts and COVID unsafe conditions. This shows that it's not only a question of parallel attacks on jobs and living standards, but also shows the attacks on all workers involved, the attacks on the various social rights of every sector of workers. And the unions that hatched and arranged these attacks. This requires, as is being put forward in the meeting, a united and independent political fight of the working class internationally against the capitalist system and its agents. And I think you can see within the meeting, those international connections are being made because we face the exact situation. What Katy about long COVID, I'll finish now, but there was a report in the press here a couple of weeks ago about long COVID in Victoria, and they gave figures, I think it was going of at least 200,000 people in Victoria suffering from long COVID, and over 40,000 are regarded as suffering from severe COVID. And what they pointed to is the fact, and what Katy sort of mentioned, the waiting list. If you're suffering from severe COVID, it's virtually impossible to get into a clinic, and you will have to go on a waiting list for over a year. At the same time, facilities that have been set up at some hospitals, and there's one hospital here in Melbourne, the Austin, that did have a long COVID clinic, has now been closed because of budget cuts. So, you know, this is the, you know, absolute disaster, and we can see parallels taking place in every single country.
Thanks very much, Sue. To conclude the discussion part of this meeting, I'd like to invite Cheryl Crisp to speak. Cheryl is the National Secretary of the Socialist Equality Party.
Thanks, Patrick. Look, I really do want to thank all the speakers, certainly the speakers whose eloquence and analysis has been, I think, extraordinarily important, but also all the comments, the discussion that's taken place in the chat. To be honest, where else can ordinary people engage and embark upon a free and democratic discussion? Certainly at the Australians Against COVID, that was possible. In virtually every other avenue and venue, it is not. Certainly not in union meetings, and of course they are very rare. And the opportunity for union members and for ordinary people to discuss is not available. I think when one works through all the experiences, the analysis, the issues which our speakers and contributors have outlined, I think what we have to then draw from this is what are the conclusions. In that sense, if we live in a system which allows over 20 million people to unnecessarily die, these people did not have to die. If we live in a system in which there is now even further, more millions of people who are going to and are experiencing a mass disabling event. If we have a situation where the most vulnerable, as Frank has outlined, are abandoned, are rejected, are not treated, as well as the flower of humanity, and that is our youth, our children, our younger people. These young people now live in a society in which if they get even mild COVID, they could be condemned to lives of illness, of disability, and possible early death. If this is a system which is creating the situation where millions of people can't work properly because of their health, where our youth are not able to reach their potential, then what else is this system capable of? It certainly is no longer interested in providing the capacity for ordinary people to work, to have enough food. And I'm not talking about Africa and Asia and the poorest sections of the world. In fact, you have an internationalization of experiences. I mean, in what we are told is the lucky country, which is Australia, you have a situation where the government will not protect its population against flood, against fire. People haven't got the capacity for shelter increasingly. Interest rates are now being increased on a monthly basis. Ordinary people cannot afford rents. They can't afford their mortgages. And increasingly, ordinary people are having to decide, will I pay the electricity bill or can I buy enough food for my children? This is now what this system is providing. And so if it is willing to do that, then of course it will be willing to enter into the descent into war. And that is what is openly now being discussed, not just traditional war, but nuclear war. Biden, all the NATO countries, Putin is talking about the development of nuclear war, the use of nuclear war. And the United States and NATO knew that that's what this would come to. When, when the provocations that were carried out were done so knowing that Russia would invade. Just the same as what is happening now in terms of the provocations against China and goading them into invading Taiwan. This is now being created, where war is the mechanism whereby capitalism resolves its problems. And our movement highlights that war abroad means war against the working class at home. And that is what is being carried out. As Julia and others have said, there is a war which is being undertaken against workers, ordinary people in this country. And a Labor government, a government which, and certainly increasingly less people have illusions in Labor, but there are unquestionably some. You have a Labor government which is now organising, orchestrating the provocations to be carried out against different sections of workers. And at the moment, it is tugboat crews who are being singled out. 600 people, 600 workers now face the full might of a multinational company, the largest stevedoring company in the world, the government, the courts, and of course the unions. Why do they concentrate on the tugboat crews? One reason is because of supply chains, because they are increasingly wanting to ensure that no worker in any field in the fight to defend their conditions, their wage levels, their working conditions, will cut across the profit drive of these companies. But be warned, it is not just the maritime workers. These measures are being taken out against these sections of workers in order to inflict a defeat upon them, so that teachers, nurses, healthcare workers, warehouse workers, retail workers, all sections of workers will be confronting the same sort of attacks. There is now almost 8% inflation. These workers were offered 1.5%. The exploitation, the workloads, the intensification of their working conditions is part of the agreement which they have to accept. What was the role of the unions? What they put forward before Fair Work brought down their ruling on Friday is, we will abandon all industrial action. They ensured to the government that any period of time was okay with the unions. What did that mean for those workers? Is that they had no mechanism to fight in the defence of their conditions and their workloads. And that is what nurses face. It's what health workers face. It's what teachers face. And it's why workers themselves have to develop their own mechanisms and organisations for struggle. The unions are the policemen for the government, for the courts, and for corporations. The unions are what will prevent workers from undertaking these struggles. Why? Because the unions defend capitalism. And now what ordinary people are facing is that if they want to be able to live, if they want to be virus-free, if they want to be able to function in a world that is not warming up to the point where human habitation is threatened, then they have to deal with the system that is creating that, and that is capitalism. And so I don't want to go on any further, but I think, it is necessary to draw conclusions from what we have all been discussing, from the experiences that ordinary people have gone through, and they are political conclusions. And we are very keen, very happy to continue discussions with whoever wants to, but we urge you, form rank and file committees in your workplaces. If you want the assistance, we will give you the assistance. Develop these independent mechanisms so people can work and discuss freely, not be censored. They have democratic rights, but also think very seriously about the need to join our party, to fight for the development of a society in which humanity can live, in which it is not confronted with the prospect of war, deprivation, and disease. And so I would thank you very much for your contributions, for your speeches, and ask you to consider at a more deeper level some of the issues that we've been discussing. Thank you.
Thanks very much, Cheryl, for those powerful remarks. I think that's a fitting note to conclude the discussion period of this meeting. Before we conclude, though, I would like to make some announcements. Firstly, I should again thank our speakers, Craig, Julia, Sue and Katy. Very much appreciate your participation, and thank you to all those who participated in the meeting via the chat box, asking questions and making comments and sharing your experiences. I'd just like to go through very quickly a couple of final slides. The first one is a financial appeal. Our party and our movement doesn't receive, unsurprisingly, big corporate donations. We don't receive funding from state or federal governments. We rely on the active support of working class people, ordinary people. So if you are in a position to financially support the work of our party and of our committees, the links, I believe, are being put into the chat box now. If you're in Australia, you can donate to the SEP. If you are outside of Australia, you may not, due to anti-democratic electoral laws. You can donate via the World Socialist website, which is the other link there. On the next slide, there is information regarding a really important publication. It's from Mering Books, and this is the first volume of a series that's called COVID, Capitalism and Class War, a social and political chronology of the pandemic. As the slide explains, the definitive scientific, social and political account of the COVID-19 pandemic. This brings together critical articles from the World Socialist website that were published in 2020. The World Socialist website has sponsored a workers' inquiry into the pandemic. Part of that has involved a series of experts with interviews. We've interviewed leading scientists and epidemiologists. We've interviewed, just to give a brief example, we've interviewed Dr. Michael Baker, who's from the University of Otago in New Zealand. We've interviewed Dr. Deepti Gudasani from the Queen Mary University in London, Dr. Eric Feigl-Ding from the Federation of American Scientists. These are all really principled medical experts who've been very active on social media and other public forums in opposing the let it rip strategy of the ruling elite. The workers' inquiry has included coverage of different workplaces, interviews with workers about their experiences, interviews with students, people with disabilities and medical issues. That is all part of our inquiry, which we are seeking to draw out the really far-reaching, as Cheryl raised, implications, social, political, as well as medical implications of this pandemic, of this social murder that's unfolded. So I very much encourage everyone to purchase that book, currently available as an e-publication for $20. You can click on the mering.com.au link there. Just like to alert everybody here to a meeting of the IYSSE, that stands for the International Youth and Students of Social Equality, which is the youth wing of our political movement. We're organising a really critical public meeting that's open not just to students and to young people, but everybody is invited to attend this meeting. It's titled "For a Mass Movement of Youth and Students to Stop the War in Ukraine." As Cheryl raised in her remarks, the US and NATO forces are pouring billions of dollars into the Ukraine, aimed at inflicting a devastating military defeat of Russia, aimed at unseating the Putin administration, aimed at dismembering, breaking up the Russian Federation. It's an extraordinarily reckless and dangerous series of provocations which have been launched. Our movement opposes the Putin administration's invasion of Ukraine, but we do so from the left, from the standpoint of uniting workers in Ukraine, Russia, and internationally, not on the basis of lining up, giving any credence of support to the US NATO military operations in Ukraine. So there are complex political issues bound up with the situation in Ukraine, in addition to the growing military encirclement of China. So the online meeting is going to be streamed at the link you can see there. It's not an ideal time, but we are encouraging everybody here to set your alarms, wake up early, participate live in this event. It's going to be an international event. There'll be speakers from the United States, from Russia, from other countries globally. So that's on Sunday, December 11, 5 a.m. Australian Eastern Time. So we encourage everyone to plug that event into your diaries and set your alarms and wake up early to participate in that. Finally, I'd just like to encourage everybody to join, as Cheryl raised, join our committees. If you are a healthcare worker or an educator, you can join the CFPE or the Health Workers Rank and File Committee. We meet regularly. We organise different actions, which we can let you know about. Both committees, by the way, are open to others as well, even if you're not a worker within those particular sectors. Within the CFPE, for example, we work to unite parents, students within the healthcare system. It's a broad and complex social ecosystem, if you like. So if you have any connection with either system, if you're a patient, for example, or a regular patient, if you have a chronic illness, certainly the Health Workers Rank and File Committee would really encourage you to join our work and to get involved. Finally, the Socialist Equality Party is urging each of you here who's not already a member to give serious consideration to doing so. You can learn more about our movement by purchasing the Statement of Principles, which you can see there. That's the basis upon which people join our party. And we are seeking to build, as Cheryl raised, in collaboration with our sister parties internationally, a political struggle against a capitalist system and for a genuinely egalitarian, democratic, classless society based on the organisation of social and economic life on socialist lines. So very much encourage everyone here to give serious consideration to doing so. On that note, we'll conclude the meeting today. I thank everyone again for your participation. Thank you for those people who've left your contact details. Thanks for those from Australians Against COVID for joining, and we'll look forward to seeing you all at the next public event, whenever that proves to be. Thanks very much.